everyone in the organization needs to understand each other's role, and the education should be all inclusive in that.
Welcome to That's Term Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Term Good. Today, my guest is Jennifer McNamara. She is the founder and CEO of Healthcare Inspired. Welcome, Jennifer. Thank you for joining me.
Thank you, Janelle. It is an honor to be on your show. I am a huge fan of your show.
Thank you. I don't remember where we met first. I feel like it was through LinkedIn. I saw something that you posted maybe.
Yeah. So I actually first saw you with Elizabeth Johnson, who I've known for a few years now. And I had gone to, I think, the first healthcare advocate summit I didn't go to because I didn't know her then, but I met her through another colleague, Jordan Johnson, and he connected us. And so I got to go to the last 3 healthcare advocate summits, and it was fun. I know you were there in Vegas. Yes. And I didn't get a chance to see you. I was so bummed. Yes. It was such a crazy week for me. I didn't get a chance to engage as much as I wanted to at that particular conference, but it was just so fun being there, and the energy was insane. I loved it.
Yeah, it was. You're around everybody that is passionate about what they do and there to really advocate and help their patients. You've got a podcast as well. So it's called the Healthcare Inspired Show, right?
Yeah, we're finishing up season 4, The Compliance Connection, and then we'll be moving on to a brand new podcast that's going to be coming out in January. So we're excited for that.
Wow, that is exciting. Okay, so the Healthcare Inspired Show, which is same name as your company. So tell me a little bit about that. What exactly is Healthcare Inspired, and how did that come about?
Well, I have had my share of, I guess you'd say, corporations I've worked for over the years. Most of my career, I've worked in hospitals, 2 main hospitals most of my career. So I really only had, those 2 experiences until I went out on my own. I did work for a technology company briefly, but I realized I really like working for myself. So I had the opportunity to go back out on my own again, try this out. Previously it was just education. And now I had the opportunity to actually, as a consultant, go out there and help healthcare practices. So I came up with a name because honestly, it's just what inspires me. I've been doing things for healthcare for over 20 years, and it's the healthcare industry that does inspire me in many ways in my life. So I thought it was fitting. And then I've been podcasting, I think, since the pandemic. So I've had a couple different podcasts before this one. I don't know if you feel the same way. It's just that drive to just share what I know and engage with people. So I love podcasting. And so my partner and I, Maya, we decided to start a brand new podcast in 2025 that is going to take everything that we've learned over the last 20 years and dump it into a podcast to help healthcare practices. So we're going to start Practice Perfect. So I'm really excited for that.
Yeah. It's exciting to be able to have conversations with people that are passionate about healthcare, passionate about what they do and helping patients. And that's really what it's all about. I think that was my biggest reason for creating this podcast, is to create some awareness and have those conversations and make sure that not only people in the industry, but anybody else that's listening that may not be in the industry, give it a little perspective and understanding as to what exactly we do and why we're so passionate about helping our patients learn and grow. That is so exciting. Yeah. So tell me, okay, as far as what Healthcare Inspired does, you're a consulting firm that helps medical practices kind of optimize their performance and enhance their patient care. So what are some things that you do when you're helping offices?
Well, as you know, my history is on the reimbursement side, but I also have this desire to help people just work smarter, not harder. And so when we decided what else we were going to offer besides, compliance consulting, coding, billing, documentation reviews, we wanted to see, okay, what is it about your workflow that might be inhibiting you being successful in your organization. So the first client we had, we were able to show them the efficiency they could have if they just got to know their staff a little bit deeper and understand what makes them tick. And so it was kind of fun. We actually put together a program for them. I interviewed every staff member, the front office staff, the doctors, the billing and coding staff, the office manager, and just said, hey, what is it about your job you like? And what do you not like? I mean, is there anything that you feel you need to do your job better? And at first it was like, am I going to get in trouble for saying this? They were kind of like leaning towards, like, I don't know if I want to say this. But after they felt comfortable, I said, this is just between us. We just want to get some information. And so I didn't call out any specific employees as to what they said, but just in my reporting, I gave an overall consensus that this particular staff, take a look at if they're in the right role for themselves. Look at the personalities of your team members. If somebody is talking to patients, at the front office, and they really maybe are best suited to talking to an insurance company because they have more of an aggressive personality, they're better fit there versus in customer service. And maybe somebody who is more people oriented can have a better success in reaching a patient, calming them down when they're upset, things like that. So get to know your staff's personalities and make sure they're in the right spot, because that's where information is missed. So if you're not really understanding the patient, you're not a good listener, you don't know how to feel what they're feeling, you might miss out on telltale signs that there's an issue, and they may not readily give you information that you need. So learning to adapt. And so that was one of the things I just loved about that experience is I've been wanting to do this service for a very long time, and I knew what to do and what would work. And so it was really, really cool to see the results when we launched this program last year. So it's been great.
That is so cool. I love that you were saying, make sure that they're kind of in the right role. Do you find it difficult right now? Because it seems like there's so much turnover in offices, and offices just need people. They need people to work. So do you find it difficult that people are just kind of hiring because they need to fill a role versus necessarily finding the right person for that role?
100%, Janelle. It's a real threat to every organization now. And that particular organization had that threat as well. They had people that were fairly new, some that were there for a long time. And one of the individuals was a little aggressive from my observations. And so the consensus was, we're short staffed. If I let this person go, I won't have anybody. And we have all these patients to check in. And so it's that whole process. Like, if I let this person go, what's going to happen? And so that is a real threat. I also work on the compliance side. And we have a policy that we always recommend you have is the code of conduct policy. And regardless of what might happen, you still have to protect your organization against a threat to it. So if you feel this person is going to be a threat to your organization, you have the obligation to your organization to make changes. You don't have to do it like that instant. It's good to plan these things. If you feel like this is an ongoing threat, make plans to change that. You can put your feelers out. You can try to find somebody in that role. Look within your organization, somebody already there that could fit that role. So you have options, but I think a lot of organizations just feel so much pressure and they just don't know where to start to find the right people. It starts with management. Again, having the right management team in place that is not going to shy away from those tough conversations. I do find that to be the case. A lot in management don't have the personality to be assertive and make those decisions. And it is their job to protect the organization. So I think that's a tough conversation to have, but you have to have those conversations if you want your organization to thrive.
What about the burnout? Because there's so many people that are wearing multiple different hats. Now it's like, like, oh, well, I've got to work at the front office, but I've also got to room patients, and then I've got to go do this, and, wearing multiple different hats. And now they're just overwhelmed because they can't find anybody, but they've got one person that they have to rely on because they're great at everything.
Yeah, I have experienced that. I've been working in healthcare offices all the way up until 2020. I was
Mhm.
in the office working with providers directly. And so I can promise you out there, I have been in your shoes, but I do see that since the pandemic kind of wound down a little bit, it's just gotten crazier. And you
Mhm.
try to pinpoint when this might have happened because maybe you see the same amount of patients as you did before. Maybe you're seeing more. But I think there's also this change in efficiency. We have technology that can help us be more efficient, but we're just not using it. We're not providing training to our team. So they're sitting there twiddling their thumbs, not knowing how to do their job effectively. So you might have had someone come in since the pandemic, a new person, but we're now in 2024. So why haven't you provided them training? Because that's the biggest
Mhm.
thing I think with people feeling inadequate or not confident in their role is they're not given the proper training. You should see someone's face light up when they finally get a process. And it's the most
Mm.
amazing thing to see because that's all they needed this whole time to just come out of their shell and to be a really great asset to your organization is to have that training. So that's an issue. That's
Yeah.
creating burnout. People are just sitting there being overwhelmed when they don't have the tools to do their job, which adds
Mhm.
to it. But it's not getting any better. It's getting worse, yes. But people just aren't utilizing their technology efficiently, which is another thing that we do try to help them with, is identifying which technology partners would best suit you. And we help them find them, as well as help them kind of declutter the technology they
Mhm.
are using. Are you integrating too much? Because there is a thing of over integration in software, but
Yeah, I
the
believe
best fit
that.
for you. Yeah, it's true, right? I mean, we see it all the time. So there's ways around it, around the burnout. And I have some great resources that I provide my clients with burnout coaching and individuals who help organizations to try to reduce the burnout that they have.
Yeah, that's good. So I know you've got a lot of experience in medical billing and coding. Tell me a little bit about that.
Well, I very first started in the front office answering phones and
Mm.
making appointments. I
So did
did
I.
have, yeah, see, I think we all kind of all of us started that way. Oh my goodness. We all
Mhm.
have that same story, right? But my goal was to get to billing and coding. I had family that worked in the industry. My aunt was an administrator of a hospital. My cousin was an inpatient coder. So I had a lot of like leanings that way. And I thought that's what I wanted to do. So I went that way. I started in the front to learn the basics. Then they started giving me charges to enter. Then I started working claims. And then I got my certification as a coder, started digging into documentation and having relationships built with physicians. And then they started giving me more specialties. So I started in radiology, just doing diagnosis coding. And then I moved into orthopedics. Was there for several years, then moved into general surgery, gastroenterology, and I just found my love for surgery. So I stayed on the surgery side.
Mm.
And that's where I mostly stay now. I have touched oncology. I have touched dermatology. I have touched lots of things, but my main passion is the surgery specialties that I love.
Now that you're consulting and supporting offices, how has that experience just with risk adjustment shaped your approach in healthcare education?
Well, it's helped me see that when we educate based on what the patient needs, everything else just falls into place. And I think that's what
Mm.
we're missing. We're trying to touch all these different areas separately, and we're putting teams in silos when they really should be working together. Everyone in the organization needs to understand each other's role, and the education should be all inclusive in that. So when I talk to physicians, for instance, I try to get them to not think about the billing and think about
Mm.
the coding part. Some organizations are kind of forcing physicians to be coders, and it's just really not
Mm.
good for them. And it's also creating burnout. But when they focus on the what, where, when, why, and how of their patient encounter, then everything else falls into place. So when we educate them and the documentation is tight, then the coders who also receive their education, they don't have to do a lot of back and forth with the physician querying. They can get their job done and the money can come in faster and more accurately. It's a win-win. So I usually start with the physicians and help them with documentation, and then it just filters in. I think that there's a disconnect between what you need to do versus what is efficient. And so
Yeah.
efficiency is just it's lacking these days. We're working harder, not smarter, when we should be the other way around.
Yeah. So do you see that as an issue across the board within all specialties? Is the documentation being kind of one of the most difficult things?
Oh, 100%. And I do touch, primary care. I touch things like nephrology, like dermatology. And I touch different specialties when I'm needed to come in for compliance or just to look at a claim. Because across the board, when you're doing this as long as I have, you can look at a claim and you can almost identify, exactly what the issue is. You may need to pull somebody in who is a coder in that specialty to say, hey, do you agree? But most of the time I can figure out it all ties back to documentation. The code was chosen because of what they had in front of them, but it wasn't payable. It wasn't as specific enough, and the payer wanted more specificity. So we tie all the way back to documentation. And I know physicians get burnt out. They do shorthand a lot, which is my least favorite kind of documentation. The abbreviations, I know it's a quicker way to say things, but it's a problem because it's not just about getting paid. It's a legal document. And it is not just for you. I say to my physicians too, it's not just for you. It's for the next physician who's going to see your patient. Patients are looking at their own records now, and they're forming opinions about what they see. You can no longer say patient denied this without getting the patient all upset. You can't say certain things in documentation anymore because patients don't understand, and they want to understand what's being documented on their behalf. So it's a problem that we have to get around. Years ago, I was watching Seinfeld. It's one of my favorite shows. And there's an episode where she goes to the doctor and she's scolded for looking at her own record. And she finds something in her medical record that she doesn't like. Of course, back then, physicians, they did write little notes about that patient, personality traits, just so the staff would know how to deal with them. My doctor did that. And it took me back to those days where that was, I guess, acceptable. We are no longer there. Yeah. And it's not acceptable to talk about your patient that way in the record because it will be seen outside of your office.
That is so funny you said that because my doctor's appointments and stuff, they're in the app because it's through like the hospital system through Epic. And, so I've gone through there and I could look at my daughter's records and I could look at mine. And one time I was just like, you know what? I'm going to just read what this neurologist put in my note. And so I'm reading it and I was like, this is really interesting. I started thinking about it. I was like, oh my gosh, patients are reading their chart notes. So the stuff that's in there, if it's not accurate, if it just doesn't even make sense because you're using shorthand or, whatever the case may be. But also insurance companies are reading these notes as well. So, they've got to be accurate. They've got to be clear and concise, but also detailed.
Exactly. And we always tell physicians too, you don't have to write a book, but you just need to make it meaningful. So you can say a lot with 3 sentences. As an example, with dermatology, right? If they write a prescription for a certain chronic condition they might have, we're looking at, okay, the history of the patient will obviously be there. What symptoms are they having? When you examine them, what body areas did you look at? Hopefully the skin, hopefully that particular area that they said was bothering them, that matches. Good deal. Let's go move on. Next is what are you going to do about it? So you're going to actually look at the documentation. You're going to say they have this, this, and this. We're going to go ahead and prescribe this medication. And I kid you not, I see all the time meds prescribed. That tells me nothing. It's not accurate because you prescribed a specific medication for a specific purpose with a specific dosage. And you obviously gave them, I'm sure, some instructions on how to follow up. If there's a reaction you have to this medication, what to do about it. None of that is there. I'm sure you said it verbally. That's not good enough. I can't report that accurately. So it's a problem.
Yeah, absolutely. So when you're going into offices, what are some common, I guess we'll say with dermatologists, what are most common billing mistakes regarding insurance claims and reimbursement?
Medical necessity is huge in dermatology. Anything with the skin. I work a lot with plastics as well. Anything where you have a combination of cash pay or cosmetic situations versus, payable claims. So that's an issue sometimes too, because sometimes the claim is split. Maybe some of the services are payable under the insurance, but some of them are considered cosmetic. So understanding how to get from cosmetic to a medical necessity is sometimes tricky for physicians. And, we want to be cautious of how we document. And so we don't maybe have red flags out there that we're trying to skirt the system, because there's a lot of ways you can appear to be committing fraud in your documentation just to get it paid. Because what is true is true. If the patient has this condition, there's only so many things you can do. And many times it's considered cosmetic. That's just the nature of it. But other times you can document clearly and have backup for that. Examination evidence, labs, x-rays, if that's a specialty you have, whatever it is. There's other testing that can be done to prove your diagnosis. And that's what they're looking for. When they pull a record, they're trying to validate their policy. So a lot of practices just don't know the policy. They don't know that you can't just have an unspecified code here. If you're prescribing certain biologic meds even, I know even from working with some people on the drug side that you have to have very specific documentation to get that covered. Prior authorizations, that's another area where the billing can be affected because you can't get your claim approved if you don't have the prior authorization evidence attached to the claim.
Yeah.
So there's just so many nuances, but there's a lot of medical necessity and documentation issues there that we see.
Yeah. So how can accurate coding, like ICD-10 codes, the CPT codes, how does that play in preventing billing mistakes, and how can dermatologists improve their coding practices, or even any other specialty really?
Yeah, really anybody, but knowing what is, I guess, kind of the framework you have to live with. So I always talk about guidelines as a framework, because when you have a guideline and you're given certain stipulations, and a lot of providers don't know what they are. And so as an office manager, billers and coders, whoever is in charge of providing that information to the physician needs to make sure it's done regularly. You can also set up your EMR system, your practice management billing system, to catch things that are always true for a certain procedure. So for instance, on the repair of a lesion, for instance, for dermatology, there are certain guidelines for coding. We know as coders, certain codes cannot be billed together in any situation. But there's also instances where it could be billed together if this is true. So documentation supports it. You add a modifier to what we call unbundling, where normally two codes are not billed together, but in this instance, it's acceptable. We have documentation to prove it. So we're going to add a modifier that says, pay me more money. That's literally what you're telling the insurance. I want more money because I did this extra work, and this is how I'm reporting it to you. They may request records, and so then that has to match up. So it's a team effort, knowing the coding guidelines, explaining those to the physician and the stakeholders, making sure they know how important it is and how it's affecting revenue. Show them the denial report. Show them all of these mistakes. Show them that you're getting denial because the diagnosis was unspecified. You didn't tell me the exact location, which I know you knew. Because if you didn't know the location, that's kind of scary, right? If you didn't know where you're operating at. So that kind of stuff is easy to fix with education, training, and a good culture of ethical behavior.
Right. So is that something that you regularly teach on? Because I've seen you do some compliance and coding webinars before. I haven't been able to join any of them yet, but just educating generally on what's important with compliance and the regulations and things that you need to keep an eye out for.
Yes, we do an overall compliance training, HIPAA, fraud, waste, and abuse, the laws that keep us, out of jail. And then we also have the coding pieces, because if you have a Medicare patient, a federal payer, like a TRICARE or Medicaid patient, you have to follow the rules because the federal government is paying you. So that's where people get in trouble. And so we try to provide compliance training on the coding pieces, because if you submit codes that are not represented in the documentation, not only will they take the money back, but you could face fines for fraudulent billing. So it can be scary, but it doesn't have to be if you have the proper education. So that's what we try to do. Is my partner and I, next year, we're going to be putting on a series of webinars every month, twice a month. We have our compliance seminar every winter now. We just started that. We're going to have an evaluation and management conference in the fall. And so, if whatever specialty you are, we're trying to cover every specialty. So there is at least something for everybody coming through 2025. And we have our podcast too. We'll be lacing in some of these topics. Dermatology is on my list, by the way. So if you're wanting to listen to some coding guidance for dermatology, stay tuned for that.
Yeah, that would be so good. Because I always think about the MIPS, when I'm talking to some of our offices, why it's important, if you want to increase your MIPS scores, then making sure that you've got specific things in your notes. But it not only helps your MIPS scores, but it also helps when it comes to that prior authorization that I'm doing, that I'm sending to the insurance, because now they're asking for so much. They want the details of what the patient's been on in the past. They want a lot of quality of life questions too. And I've been seeing a lot of that. But also when it comes to those ICD-10 codes, if you're putting in an unspecified ICD-10 code and maybe that medication has a specific ICD-10 code, insurance is going to look at that. They're going to say, oh, well, we looked in your chart notes and we don't see that diagnosis in there, so we can't approve the medication. But what if for some reason they miss that and it gets approved? And then what? Is there risk for if they potentially get audited and that code's not in there?
It's potential. It happens more often with the CPT codes that affect the billing. The diagnosis codes can be changed later on because the documentation after the fact is going to be what they go off of. They're going to go off of the final documentation that was signed by the physician, what the final diagnosis was. So if it goes through on the diagnosis side and approved for unspecified, it's going to match more what their policy states. So if they have a policy that requires it to be very specific, that's what they're going to go off of. But for the procedures, for a lot of procedures, you have to have those codes on the authorization. If you change the code down the line, or it changes it in the actual procedure, it could affect your payment because it wasn't originally authorized that way. So that's where we run into more issues, is on the procedure side versus the diagnosis side. But it could happen depending on the policy.
Yeah, that makes sense. So as far as technology, because, things are changing so much right now, especially with AI and things like that, how does technology play a role in the future of medical coding and compliance? And how is it shaping the way that you teach and educate offices as well?
Well, it is changing rapidly. There is a lot of technology out there that is really fast and efficient to help coding teams get to the right code faster. It kind of has this way to look at a documentation from a clinical standpoint, because it can pull data from anywhere. Now, the thing that we're worried about from a compliance standpoint is, of course, using technology that's not safe within your system, outside of your system. But if you have a secure AI platform reading your documentation, spitting out potential codes, it's not that it's going to replace coder necessarily. And I think that's people are afraid of. It should never replace the actual human coder. It's aimed at helping them be more efficient and analyze data a lot quicker. And so that is where I see it going and where it should go. We should never replace a human being. The logic that the computer brain we have in our heads, it may not be as fast sometimes as we get older, right? But it still has the ability to think analytically and to think logically about a scenario where it may take the AI several times when you have to redirect it. No, I meant this. No, this. And you have to keep telling it no, because it's not thinking correctly. We're not there yet. I don't know when we'll get there, but if you've ever tried to type in anything and asking a bot to do something, sometimes you have to say it multiple times, use a different word, and then it'll get it. But a human being, they can usually understand, right?
Well, so crazy. You're also an author.
I am. This past year, it was kind of exciting, scary, and fulfilling, and I'm on to my next one now. So it was an enjoyable process for sure.
Yeah. So you wrote a book called Clear and Connected. So tell me a little bit about that, and what do you hope that healthcare professionals will take away from that?
Well, I've been thinking about for several years. When the pandemic started, I was just, I think we're all stuck at home thinking about life. And I started to write for my anxiety, and I started to really enjoy it. It was therapeutic. And so I would write articles, I'd write blogs, and then I started seeing my colleagues writing books. And I thought, well, I never thought I could do something like that, but let me think about this. What do I want to write about? And I started to think about what is truly an issue in healthcare these days, and where do all these problems that I'm dealing with every day in coding and billing, where does it all come from? And then I started to think more, it's communication. And so I wanted to write a book on communication skills. And I kind of designed it as a hybrid approach where it's informational about processes and compliance, but it's also my own story. So I talk about personal things in there. I talk about my journey, some of the challenges I've had, and I turn that into kind of like a guidebook. We ultimately want it to be a book that organizations use to improve communication training in their organization, adding it to their annual education, making sure they make it part of their compliance plan to have communication training. So it's my goal to make it something that everyone can benefit from.
Yeah, that's amazing. If anybody is interested in your book, where can they find that?
Well, they can go to our website, healthcareinspiredllc.com, and you can actually see at the top of the screen, there is a link to purchase the book if you want a signed copy. It's on Amazon as well. So we're on Amazon ebook and print, but you can also order a signed copy from our website.
Okay, that's cool. I'm excited for that. I'll have to check it out. Did you say you're writing another book too, or what's for you? What's going on in the future?
Well, yeah. So I'm actually getting together with several other coders, and we're writing a book for orthopedics. So we are writing it for coders by coders. So we have 3 to 4 specialists, I would say, in orthopedics, and we're writing it together. So it's a head to toe approach to understanding how to code for orthopedics. It's just something that I wanted to do that's just, there's something really out there for it. You have anatomy books over here, and you have blogs, and there's not really an actual coding book just for orthopedics. Maybe books that have all the specialties in it, but not really specifically just for that, where you get the information that coders know. So we're dumping our brains into this book, and we're hoping that it's well received and it's going to be a useful tool for everyone.
Wow, that's exciting. I love that. Before we end, what is something that you would like for offices to understand and to know, or just to take away when it comes to either compliance or billing and coding, or just generally helping their office become one of the best in the industry and just being the best support for patients as well?
Well, the first thing I want to say is take a look at your culture. If you see any issues that are preventing you from being a team, address them quickly, because that's one of the biggest roadblocks. And think about the patients you serve. What do they actually need? They need to see teamwork. They need to see an organization that is thriving internally, and they feel more confident in you as an organization. And think about your coders and billers. I personally have a strong feeling towards these group of individuals because I am one. It's where I started. I have a strong connection to that community. I'm always advocating for them because they are not looked at as professionals in some areas. Some organizations push them aside as not a necessary department when they are an essential department that is affecting your revenue. Physicians. I'm a huge physician advocate. So I really feel that connecting your coders and your physicians together, understanding that the knowledge coders have is very similar to what physicians have. We are required to know what they know. We don't just go to medical school. We don't get paid as much as they do, but we are required to know what they know to do our jobs. And so I feel like that's what I want organizations to know, is to use your coders, give them confidence, provide that training for them, and know that the problems you're having, they might be a systemic issue that you have to address internally. So make those changes, work on establishing a compliant culture. If that means making changes in your staff, don't be afraid to do that, because that's probably where your bottlenecks are. So take a look at it and let me know if you need some help from the outside to looking in to give you some guidance, because that's what I love to do.
Yeah. Well, where can they find you if they do have, anybody does have questions?
Well, I'm on LinkedIn. I'm on Facebook. Our organization's on Facebook, healthcareinspiredllc.com. You can also visit us. We have a TikTok page. We have Instagram. It's all there. But if you go to our main website, healthcareinspiredllc.com, there's many ways to connect with us. You can email us, contact me on LinkedIn. Probably my favorite way to connect is on LinkedIn.
Mm-hmm. Okay. Great. Well, thank you so much, Jennifer. It was such a pleasure talking with you, and look forward to connecting again soon.
Sounds great. Well, you have a wonderful day. Thank you, guys.
Thank you. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.